We begin tonight with the status of the coronavirus across the state. Right before the Passover, Easter, and spring break holidays, case numbers in South Carolina were at a plateau. But as DHEC predicted, about 2 weeks later, we're seeing a small uptick. The agency says it's nothing too alarming at the moment, but they are closely monitoring these numbers, hoping we won't end up in the same situation as Michigan and experience a dramatic COVID spike. Dr. Jane Kelly, assistant state epidemiologist with DHEC, says the newer cases we're seeing are from the younger age groups who aren't vaccinated in numbers just yet.
We're still urging people who may view themselves as, I'm young, I'm healthy, I'm not worried if I get COVID-19, to reconsider. And to reconsider getting vaccinated for several reasons. Number one, even if you're young and healthy, we have seen young, previously healthy people become very ill with COVID-19. And yes, death is rare, but serious illness can have serious long-term consequences. There's also something called long COVID or long haulers, people who have COVID, maybe even just mild COVID, but then their symptoms linger for months. And there is some evidence that vaccination can actually help you get rid of those symptoms earlier. And the last thing to emphasize is, we're never going to be able to stop with the mask distancing, avoiding crowds until we have most people vaccinated.
DHEC says their goal is to get 70 to 80% of South Carolinians vaccinated. That timeline is still in the works. Here's a look at the latest COVID-19 numbers for the state. DHEC is reporting 847 new confirmed cases of the virus and 2 more deaths. The positive rate is 4.4%.